Well, joining us today to look at the topic of the day, we have with us Martin Obono. He is a lawyer and a team lead of TAP Initiative. He is a strong business development professional with an executive program focused in expanding impacts for NGOs and public institutions from Harvard Kennedy School. He joins us from our Abuja studio. It's a pleasure to have you on the program today.
Thank you for having me.
Of course. We also have joining us via Skype from Lagos, Ibukuntunde Oni. He is a medical doctor and a certified health and safety specialist working at the intersection of healthcare, business, and technology. He is also the retail growth manager at Helium Health, a health tech company with a vision to accelerate Africa's transition to a technology and data-driven healthcare sector. Dr. Tunde Oni, it's a pleasure to have you on the program. But let's, before he gets back on, let's also joining us again via the Google Plus Hangout is Godi Wogu. He is an experienced Nigerian professional based in Prague, the Czech Republic, who has worked in different industries like oil and gas, IT and computer, and currently in the automotive industry, where he is the program purchasing lead in Volkswagen Porsche Europe business. Godi, it's a pleasure to have you on the program as well.
Thank you very much for having me.
Of course. Let's kickstart this conversation for us, Godi. It's been some form of success in the fight against COVID-19 in the Czech Republic. What leave do you think Nigeria can borrow, first of all, as we also, heighten this fight?
So the key thing here was the testing that was performed generally. So initially there was a lot of confusion as regards to how to approach this fight against COVID. So a lot of laws or orders were given. So what happened was that the messaging became very consistent after the first inconsistencies in the first weeks, which actually every country experienced. So the messaging was that we should there was lockdown, state of emergency, but essential services were let to run, but people must have their face mask on whenever they leave their house. So you are able to go to the shop, you're able to go to the pharmacy, you're able to go to the hospital, you're able to go to the auto service, mechanic. So you have to keep the social distance. If you go to the shop, it is a norm here that you actually have to wait for your turn. So you have to, now people have to keep the 2-meter distance when they stand at the shop or on the line to buy something somewhere. This approach really helped a lot. But then before they actually decided to reduce or lift the ban, they actually had performed a lot of tests and got a very good idea of how the disease was being spread. So in that regards, they said, okay, people can slowly, go out, do other things, but still keep the social distancing. In this way, they achieved a very good measure of success. Actually, in the very first 2 weeks, they implemented the use of the mask. So it's one of the first countries that made it mandatory and still makes it mandatory that people use the face mask whenever they are leaving their home. It is not a complicated mask. It's, you can also have the material as I have here.
Let me hold you there for a bit. Let me quickly go back to Abuja studio where we have Martin Obono with us. Martin, so there was this, most of all of these measures that he spoke about were also in Nigeria, and perhaps that was why the federal government said they would gradually begin to ease the lockdown. But how would you say Nigerians have adhered to these guidelines, after the lockdown was lifted last Monday?
I think it's actually not very encouraging because the numbers speak for themselves, as the case may be. If you go to places, certain places like ATM queues since the lockdown was relaxed, you will see the way Nigerians have conducted themselves in such a way that it doesn't tally with the basic order that the government has given and the basic principles or the basic rules that NCDC and the WHO have actually set in place to say you have to maintain social distancing, of 6 meters or thereabouts, 6 feet rather, or thereabouts. And then you also have to wear a face mask. But people are still clumped up together, sticking together, and not too many people are actually walking around with hand sanitizers. Neither are they walking around with gloves, and as the case may be. And this is what has actually spiraled into the increased number of positive cases that we have seen in the last 10 days or 11 days, as the case may be, because if you look at it critically, in the last 10 days, we have had over 2,000 cases of positive people, compared to when we actually had our first index case, which was on the 27th of February, and down to the 24th or 25th of March, when we recorded our first casualty. So if you look at it, the numbers have increased exponentially, and that is because citizens have not really adhered to the basic rules of social distancing and the advice of government to ensure that you move around with face mask, you move around with gloves, and ensure that your hygiene is top notch as we try to ensure that we keep the virus at bay.
All right, Martin, that's pretty much a gory picture you're painting as to the facts that are actually on ground. But let's go back to Dr. Tunde Oni. Again, so as it is now, like Martin just said, numbers have doubled in the last 10 days. But what can we do, in terms of trying to get these numbers to be on a minimal side at the least?
To be honest, I think at this point, it's really out of our hands if we're not locking down. The idea is to lock down to prevent the spread in terms of multiples. And we all knew this would happen, which is why when it was announced that lockdown was going to be eased, a lot of people started posting different things online as to how May 4th was going to be a day to reckon with. And that's because we expected that numbers would triple, because there's already a lot of community acquired COVID, in quotes, right? It's community transmission. We're done with transmission of reports, and it's
well, let me quickly go back to Martin again. Martin, so Dr. Tunde Oni was talking about things that we can do, to ensure that the numbers don't go more than they are, or at least be on the minimal side. So one of the things he made mention was the fact that when May 4th was announced as the date for that would begin the gradual easing of the lockdown, there was all kinds of posts online and thereabout. But are people saying that, or do you subscribe to the school of thought that felt that the lockdown shouldn't have been lifted in the first place?
Well, it depends on the environment you find yourself. So that would be my answer. First of all, in a country where we have very our income, the way our economy is actually positioned is in such a way that more than 70% of the people depend on informal sector, which is more like people survive on daily basis, on daily income. So you can't actually lock down an economy in that way. However, there is a very strong link between opening up an economy and encouraging, or rather spread, basically. So the more you open up an economy, people will definitely interact. And the more people interact, the more the virus will spread. So the only way the government, the only way the government will have said we will lock down 100% and ensure that we enforce this will have been if we had social safety nets. And because our country and our governments, and I'm not just talking about this administration, but previous administrations up till now, have never really thought about the poor. They've never really considered having a solid database.
That might be subjective, Martin. If I'm coming, that might be subjective, saying that the poor have never been put into consideration. But I'll come back to you again just in a moment. Let me quickly go back to Dr. Tunde Oni, who was pretty much trying to wrap up his thoughts as to what we can do to ensure that the numbers don't increase beyond where they are now.
Yes, as I've saying at home, wearing your face masks, washing your hands regularly, and then carrying your sanitizers up and down, wiping your hands, trying not to touch things as much as you would when you go out, trying to make sure you wipe down before you touch things, even at home, wiping door handles, wiping table surfaces. but most importantly, washing your hands, because that's the easiest way to get rid of the virus. But then also making sure you have your face masks, proper face masks out there. I mean, cloth face masks are available now, and they say now that wearing face masks is better than not wearing anything at all, because it prevents you
Gotti, let me
from
come to you
getting
now.
it
So
and
one
prevents
of
the
the
other
things
person
that
from.
Martin talked about is the fact that the sector or the economy is pretty much an informal one, and a lot of people would find it difficult to survive if this lockdown continues. What can be done in that aspect to ensure that people actually have some form of remote jobs while this lockdown is on? Gotti.
Oh, okay. But to me, yeah. So what I think should be done is that the government cannot really carry, no government, no economy in the world can carry such situation or problems on their shoulders. So I think that letting people, if government actually provides a guideline how people can really operate their business, one of the challenges I see here is that Nigerians are very difficult people to manage. If you give Nigerians instruction, they don't want to do it. They don't want to take it. They think that they will do something different. So you can let people to operate, traders to really run their stores and shops to open, but they have to have, if it is a must, they have to have their mask on their face, because these are the people that really drive the economy somehow, because they are the regular people who you go to buy food stuff from. Locking people down and then opening up a few days and then letting them to go back to the shop to buy something to restock is not helping to stop the spread. It's not helping to save lives. But you can actually implement that people should keep this use of mask on, hand sanitizer. Every shop should have it. If they don't have it, they should not be allowed to operate. They should be able to sell their things. People should learn to stand on the queue.
Gotti, I think this is a good note to kind of wrap the conversation up. I'd have to say thank you for joining us on the program today. Gotti Wogu, you joined us from Prague in the Czech Republic, as well as Dr. Tunde Oni-Ibukun, you joined us from Lekki in Lagos here in Nigeria. Thanks to both of you for joining us on the program. And also, thank you to you, Martin Obono. You joined us from our Abuja studio. Thanks as well for sharing your thoughts. I will take a break on the program. When we return, we'll be changing our outlook to look at sexual and domestic violence in this period. Please stay with us.